this X-ray, we have a definite abnormality in the small bowel. So let's look closer at the X-ray. We have dilated loops in the left upper quadrant, whereas on the right the colon appears normal. So let's look first at the colon. So that's a colon full of feces there. That looks normal. And descending colon looks normal. So that's the colon. Now we look at the other loops of bowel. So we look at these loops. They're different, and the reason they're different is that they have valves that cut across, and these are called valvula conniventis. You can see them there, little valves. And this is what makes this small bowel. Sorry. Now, when you have normal colon and dilated small bowel, the diagnosis would be small bowel obstruction, and the usual cause would be an adhesion or possibly a hernia, sometimes an internal hernia, or a hernia in the groin sometimes can cause obstruction as well, especially if the hernia gets incarcerated. Some tumors can block the small bowel, maybe a mass even in the cecum can block small bowel. So we'll have a look and see what the CT shows. That should give us an idea of what's causing the obstruction. So let's bring the CT in there. So what have we on the CT? Okay. So we look at the CT, we can see that there's a normal cecum, but the small bowel, which is there, is dilated. And if we come down to the lower pelvis, we can see that the terminal ileum, which is the part of the loop that goes into the cecum, is quite thick-walled. So we have a stricture and inflammation of the terminal ileum. So we could make that a bit bigger there. That's the terminal ileum there, quite a long stricture. And you can see how thick the wall of the terminal ileum is there. So another cause of obstruction to the small bowel is a stricture, and the commonest cause of a stricture in the small bowel is Crohn's disease. So this is likely to be Crohn's disease. There's a bit of inflammation around the area. There's no free air and no free fluid, no sign of perforation, just an obstruction. So the diagnosis is small bowel obstruction, secondary to Crohn's disease. That's the diagnosis.